February is American Heart Month, a time when people can focus on and learn more about the health of their hearts, and especially during this time when so many people are contracting and testing positive for COVID, there are more concerns about the impact that it can have on normally healthy hearts. Our sponsor, Heart and Vascular Consultants, may have answers to your questions, and we are joined by Dr. Delair Gardi, a board-certified cardiologist. Dr. Gardi, thank you for being with us.
Hi, good morning. Thank you for having me on the Live on the D.
It's our pleasure. It's our pleasure. So tell us about the Heart and Vascular Consultants and the services that you offer.
Sure. Heart and Vascular Consultant actually was founded 15 years ago. And our mission is to provide the best comprehensive cardiovascular care for our patient while keeping their health and safety first. We have a state-of-art lab actually here that provide a full line of service, including cardiovascular and venous services.
Okay, now Dr. Gardi, let's talk about this. What kinds of impact are you seeing on people's hearts from COVID?
You know, COVID has been going on for 2 years. This pandemic, we thought it's gonna be gone by now, but it's not. And we have learned from our experiences that the virus can affect multiple organs in the body, including the heart. So the heart is not spared. When the virus affects the heart, it can affect the lining of the heart, it can affect the muscle of the heart, and even the electricity system of the heart. The patient presentation can be different. A lot of patients that I see present with chest pain, and you'll say, is this chest pain coming from angina, like blocked arteries, or from the virus? Sometimes they present with shortness of breath, and the shortness of breath could be coming from the lung being affected with the virus, or it could be coming from the heart being affected by the virus and the muscles getting weaker in here. One of the problems that I see a lot with the presentation with the patient that you have to pay attention to is the arrhythmia, which is the irregular heartbeat. A lot of these patients present with fluttering. They fear their heart going to jump out of their chest. And when you do EKG, sometimes we find atrial fibrillation, which could be a problem because atrial fibrillation can cause a stroke. And this is very important to pay attention to, address it early, and treat it. So there are many ways the heart can be affected by the virus, and it needs prompt attention.
Yes, most definitely. Now, beyond COVID, what are some general symptoms that someone's heart may not be working properly?
You know, anytime you have chest pressure or chest tightness, remember here that women and men can affect it differently and they can present differently. Women, a lot of time they present with flu-like symptoms, getting tired, I don't feel good. And sometimes they present with pain in the jaw. They think it's a tooth pain, sometimes back pain. While the more of men, they present with chest tightness, chest heaviness, or shortness of breath with task you did it before and you have no problem. Now when you do it, you run out of breath much easier, much quicker. So you think, what is the problem? This is when you have to pay attention. This is with the time when you call your doctor and say, I have a problem, and get consultation.
Yeah, always good to go see your doctor. Now, what treatments can Heart and Vascular Consultants offer for these kinds of conditions and concerns?
Sure. Heart and Vascular Consultant offer a full line of services, as we mentioned earlier. And this is starting from a diagnostic heart cath to placing a stent to the heart itself, or sometimes complex procedure. And these complex procedures, including structural heart disease, any complex procedure that requires mechanical support to do a complex intervention on the heart is also done here. We do structural heart disease where we can place a valve through the transcutaneous approach, where we can put a valve in your heart without opening your chest. We do procedures like putting a Watchman, which is a left atrial appendage device. There are more of these kinds, especially for the people who cannot take blood thinners. So then these people can be independent of blood thinners. We also treat veins. We do vein ablation. So full line of service that we provide in here, it's all right here.
Wow, so much to know, and thank you for joining us and sharing all of this very important information, Dr. Gardi. We appreciate you.
Thank you for having us again.
For more information on services they offer and to schedule your appointment for a screening, visit their website, hvchealth.com, or call 313-832-8888. Again, that website is hvchealth.com, or call 313-832-8888.